Some of his last words to me actually were, "Get me the hell out of here, I don't want to be here, I want to go home."
Alan Lishman had been diagnosed with terminal cancer, diabetes and heart disease when he fell and cut his head. He spent almost 2 days lying in a hospital corridor. His family told us he wasn't seen even once by a doctor. Alan died from an infection as a result of his fall.
It was 40 hours that he was in the corridor. We were told it was 36 hours for a bed, but then once we'd hit the 36-hour mark, they just kept saying, "I'm sorry, we haven't got anywhere, we haven't got a bed." Absolutely appalling. I mean, you wouldn't treat an animal how some of them patients are being treated.
NHS England wants to see less than 5% of patients waiting more than 4 hours in A&E before a decision is made on their care. This target hasn't been met in almost a decade. And that poor performance continues after admission, with the number of patients waiting more than 4 hours and 12 hours increasing significantly since the pandemic. Sky News reported this week from the Health Secretary Wes Streeting's local hospital. We show the King George's Emergency Department struggling to cope with rising numbers of mental health patients in crisis attending A&E. He says a government plan to create new mental health assessment facilities and 14 new same-day urgent and emergency treatment centres will help to lift some of that pressure.
I saw Sky's report, and I think what they have shone a spotlight on is not just in my local hospitals, but what I have seen in hospitals right across the country is far too many people turning up in busy, noisy, crowded A&E departments, not because they needed to be in A&E, but because the support they needed, the right care in the right place, wasn't available at the right time.
The plan itself admits that the health service's inability and unwillingness to work coherently, both internally and with social care and other service providers, has led to a deterioration in performance that would have been unimaginable a decade ago. Some senior emergency department figures are concerned it lacks ambition.
They've set an aspiration that no more than 10% of people going to emergency departments should spend more than 12 hours there. Now, the problem is that's very unambitious. We've only had that sort of level of 12-hour waits in the last couple of years. If you go back to March 2021, that level was 2%.
Maureen says her family have lost faith in the NHS's ability to treat patients properly in A&E. And they're not the only ones. But it's hoped that this plan can restore some of that broken trust. Ashish Joshi, Sky News.